If you're in your 20s and babies feel like a someday thing, maybe a distant someday, this episode is for you. Actually, it might be especially for you because the best time to prepare your body for pregnancy and motherhood is before you're actually pregnant. It's before you're even trying for a positive pregnancy test. It's right now. And in this quiet season, before you're even thinking about motherhood, it's exactly when rooting yourself well is so important. Building the foundation now so your body is ready when the time comes. Here's why it matters in your 20s. Something that doesn't get talked about enough is that fertility and reproductive health aren't things that just happen to you. They're built over time. The food you eat, the stress you carry, the sleep you get or don't get, the hormonal birth control pill you may or may not have been given, the toxins in your environment. All of it is quietly shaping your hormonal health right now. Your 20s are genuinely one of the most important windows for laying that groundwork. Not because something is wrong, but because prevention and proactive care is so much more powerful than repair. Think of it like tending a garden. You won't just throw seeds in an unprepared soil and hope for the best. You root well first. You take care of the soil. So you know that when you go to water it and give it the sunlight that it needs, that it is going to bear good fruit. So what does that actually look like? Let's walk through the foundational pillars I love to focus on with my clients. Number one is to nourish your body with real food. This comes back to that food first mentality always. Your body needs adequate fat, protein, and micronutrients to produce hormones. Full stop. If you're chronically undereating, over-restricting, or surviving on processed food, your hormones will feel that. You need to start building a relationship with food that is nourishing, not punishing. This is also where I recommend some specific supplements to help fill the gap where our modern diet and soil quality just isn't able to fully nourish the body within. Next is to understand your cycle. Your menstrual cycle is your fifth vital sign, and most women have never been taught to read it. Start tracking. Know what a healthy cycle looks like. Understand your luteal phase, your ovulation signs, your PMS patterns. This information is gold when you start trying to conceive. And it can also alert you early if something is off hormonally. Dive back into past episodes where I break down my own cycle health challenges and what I helped do to regulate them. And this was all done in my 20s, well ahead of trying to conceive. 3 is to be intentional about birth control. This is a big one. If you're on hormonal birth control, we need to take steps to get you off and learn how to regulate your cycle naturally. I don't recommend the Band-Aid approach of just stopping cold turkey because there are nutrients that the birth control pill actually depletes our body in. So if we can help remedy that ahead of coming off of it, it can help that transition off be much more ease-filled. I also caution anyone thinking about birth control to know that there are other options and that birth control is a Band-Aid approach. It's not getting to the root cause of your hormone concerns, of your acne concerns, of your weight, of your PMS patterns, right? We need to be very intentional and understand the risks associated with, quote, the pill. So if babies are on the horizon in the next few years, it is definitely worth having a conversation with your provider about your options, your timeline, and actually getting to the root concern about what's going on and why you would want to be on the pill in the first place. 4 is to reduce your toxic load. Your liver processes your hormones. So anything that burdens your liver, heavily processed food, alcohol, synthetic fragrances, conventional beauty products laden with chemicals, and cleaning products, my goodness, these all can quietly interfere with hormonal balance. You don't have to overhaul your entire life overnight. In fact, I recommend making slow, intentional swaps so that it's not overwhelming because stress alone is not going to be a good thing when it comes to regulating our cycle and optimizing our preconception health. So your hormones will thank you if you make a slow, intentional shift, but that is why starting in your 20s is of the utmost importance. I started in college, well ahead of trying to conceive, well ahead of even becoming a mother on my radar. And this makes that transition process so much smoother and so much easier. Number 5, if I'm counting correctly, is to prioritize sleep and reduce stress. Cortisol, which is your stress hormone, directly competes with your reproductive hormones. Chronic stress and poor sleep are two of the most underrated disruptors of fertility. Building rhythms of rest, boundaries, and nervous system regulation now is one of the most loving things that you can do for your future self and future babies. And number 6 is exercise. So as an orthopedic and pelvic floor physical therapist, prenatal and postpartum corrective exercise specialist, this is my secret sauce when it comes to preconception, health, and things that you can do in your 20s to set yourself up for success. When we are chronically over-exercising, we're doing high-intensity workouts, we're running marathons and half marathons. I did it too, but we have to sprinkle in there nervous system regulating activities. Think yoga, Pilates, mat-based exercises where our breath is paired with our movement, intentional mobility exercises. These all are foundational for your pelvic floor, your reproductive organs, and your stress response state. I outline all of this inside my Holistically Well Preconception program, which I will link in the show notes for you. You can find it at drkaylaborchers.com/preconception and use code POD20, that's POD20 for 20% off. We dive into each of these areas specifically because I want you to have the tools in your toolbox now so that you can get ahead of supporting yourself well before a positive pregnancy test. And again, if you have questions, feel free to reach out to me specifically because it is a joy to support women along this journey. And I especially love when we can do so proactively because it is that much easier to address these areas now versus waiting until you're in your 30s and just desiring that baby right now. So I want to offer you this reframe. Preparing for pregnancy isn't about being in a rush to get there. It's about honoring your body in this season so that every season after it is supported. You are not behind. You are not too young to care about this. You are actually in the perfect position. You have time, and time is the most powerful tool in this whole process. Tend your soil now, right? Go back to that garden analogy, root well, and trust that what you build today is quietly becoming the foundation of everything that comes next.